Hi, my name's Ewen McPhee. I'm the current president of the Australian College of Rural Medicine. Just to tell you a little bit about myself, I'm a rural GP and I'm also a GP obstetrician. So I've been a long-term resident of the town of Emerald in central Queensland. I first moved there nearly 30 years ago and that was as the local medical superintendent, and I was responsible for a hospital that was very busy. I did anaesthetics, obstetrics and surgery in association with three other great rural generalist GPs. Since that time, Emerald's grown quite a lot, and I have my own practice which I'm the principal of, and we have quite a few registrars, a number of other clinical educators, and we offer fantastic service to our rural community. I guess since the last few years I've moved into medical education, also medical politics. I was president of the Rural Doctors Association of Australia at an interesting time, which saw the announcement of the National Rural Health Commissioner and his first order of business, which is to create a National Rural Generalist Program. And in association with that, I've been engaged with James Cook University through Generalist Medical Training, one of the regional training organisations, and with the University of Queensland in my role as a regional training hub coordinator for Central Queensland. The intention is that my future career, my future aspirations are really about building capacity for local medical education from students, medical students, end-to-end programs for our kids so that they can do their whole medical course in the regional area, and leading on then into quality intern training, junior doctor training, and then a career choice. And one of those really positive career choices I want to see is that of rural generalism. 30 years ago when I first moved to Emerald, I had the great honour, I guess, to work with three other fantastic rural generalists, and we did everything in Emerald. And if one of us was giving the anaesthetic, someone else would do the surgery. We're rediscovering that now. I think there's been a long hiatus of trained, multi-skilled rural doctors, and we're seeing that re-emergence of that. Certainly Queensland has led the way, but every state in Australia recognises the need for a rural generalist program, the need to deliver high quality care to rural Australians, and to address the inequalities of access, the shorter lifespans of rural people, and improve equity as well, to make sure that people can expect the same or even greater standard of care from their country doctors and their country healthcare teams than they could expect by travelling thousands of kilometres to see somebody in a city area. And that's, I guess, my passion, is to make sure that we do grow our ability to deliver highly qualified, well-trained and resilient clinicians into our rural communities, and know that they're going to be delivering quality care in a well-supported way and improving health outcomes for our rural people. What I believe about the College of Rural Remote Medicine is that it really has matured. It's become a polished primary care, general practice college, training well-rounded clinicians who can deliver quality primary care. But the important thing about the Australian College of Rural Remote Medicine is within Australia we have the opportunity to expand and to build our capacity to deliver those extra skills that clinicians need. And what I'm talking about there is your procedural skills like obstetrics, anaesthetics and surgery, but also your other skills such as population health, public health, paediatrics, internal medicine. We're the college that defines rural medicine and brings a rural lens to our curriculum, and we are the arbiters for how people are trained. There are many specialist colleges in Australia, and we recognise and have great working relationships with those colleges, but it's important to recognise that the College of Rural Medicine is the rural college. We will assist our specialist colleagues to develop their training capacity and their training pathway for our registrars. And this is important, our registrars, to make sure our registrars are well cared for and well looked after by specialist colleges, but remain very closely associated with our college, the College of Rural Remote Medicine, and our governance, our assessment, our CPD, and I think this is a really important aspect of what we do. Externally, the college is seen internationally as a leader. We've got a great story to tell. Recently I spent some time in Korea and I was able to speak to a number of resource poor and developing countries clinicians who are looking for leadership in developing curriculums that will address the equity and access issues, the quality of care issues that they are facing in their own countries. Some of those countries are facing fragmentation of their primary care general practice systems, and they're looking for leadership from Australia and from the Australian College of Remote Medicine in these areas of really making sure that we get the message that fundamentally better healthcare rests with a robust primary healthcare system. More specialist services, more investment in technology, more investment in major hospitals does not fundamentally address the healthcare of country people. And right across the world, ACRRM has got a great story to tell. And finally, we also are leaders in giving our registrars and our trainees options for advanced skills training. We're looking at opportunities to train for austere environments, looking at working with armed services, with Antarctic Division, with perhaps even space exploration in the future, because we are the College of Rural and Remote Medicine. We are also the college that recognises that fundamentally we are primary care clinicians, but also we are generalists. And we need to provide our registrars and our trainees with both those key primary care qualifications, but also the skills and extra knowledge that they need to operate in a wide variety of environments. While we recognise our country towns are critical, we also need to address the needs of a doctor working on a patrol boat 3 days from Darwin. We need to recognise the skills that a doctor requires for the long winter in Antarctica. And the sky's the limit as to what our college can achieve, and I'm looking forward to leading the college through the transition from government-led training to college-led training. This is going to be probably the most important aspect of my presidency. We'll be making sure that our story is a fantastic story and that we, through self-determination, are able to even grow and expand our reputation as the college for rural and remote medicine, for primary care medicine in resource-poor environments, both nationally and internationally.